I'll talk about this fancy name, bio-nanoscaffolds for post-traumatic osteoregeneration. As I said, it's a fancy name, first of all, like all the affiliations and the institutions I work for. So it's a very fancy name for a very basic and urgent need, which is try to find a solution for a problem that the Army brought up to us, which is the amputation of the limbs of the soldiers due to shattered bones. So the Army did a great job at saving the lives of the soldiers, didn't do a good job at saving the limbs, and that's what's causing more than 4,000 amputations to these days. And it's incredible because even if you just have all the tissues around and the nerves and everything, but you don't have the bone in one piece, you still need to amputate a limb, which is kind of a traumatic intervention. Now, we got contacted by this guy in the middle, Mitch Zekin, who is a program manager at DARPA. DARPA is the Pentagon Defense Advanced Research Project Agency, which deals with all these crazy ideas and revolutionary research. This is a picture that we took at the kickoff and review meeting in Key West in January, and there's a reason why I put it there. You'll discover it at the very end. Anyways, when they contacted us, they asked for miracle material, which we call it fracture parity, but this miracle material should do a lot of things. Should provide, it's like the Ten Commandments, provide temporary mechanical support, act as a substrate for osteoid deposition, so to promote bone regeneration. It should somehow mimic the architecture of the real bone, so promote also vascularization and in-bone growth. It should encourage the bone cell migration into the scaffold. It should be osteoinductive, enhance the cellular activity towards osseointegration, degrade in a controlled manner so that the load transfer to developing bone can be taken care of, produce non-toxic degradation products, be non-inflammatory and non-immunogenic, and it can also be sterilized because it has to be shipped to all corners of the world. So a lot of questions, and of course I can't do not even one of that by myself. So we really ended up putting together a team of stars in the world of science. I just had the pleasure to coordinate the whole team. I wrote the grant and I put together the team and I'm running it, which is crazy because it's like 60 people, 7 different institutions in 5 different cities. But anyways, these are the players. And these are also the components that we're gonna use. We have a polymeric matrix, polymer, polypropylene fumarate developed by Tony Mikos. This is the guy over here at Rice University, and these are his collaborators. Then the nanoporous silicone enclosure, something that I presented last year, and that's my staff together with Professor Ferrari and a lot of other people like Professor Liu, and that's the rest of my team. Then the peptide amplifier biomimetics, a technology developed by Sam Stupa Northwestern and by Ramil Capito, who is his assistant professor. Then we have mesenchymal stem cells, because there is no way to promote osteoregeneration and bone growth if you don't put a little bit of stem cells. And we're working with Paul Simmons, who is one of the world experts in mesenchymal stem cells. He's already in clinical trial in Australia for the use of mesenchymal stem cells. And then we had the pleasure also to work with George Whiteside on the development of the bioadhesives and the management of bioinformation, which is very crucial when we talk about bone tissue engineering. And then we have a lot of mathematical modeling, which I will skip, otherwise you will all fall asleep. But it's the work done again by Professor Ferrari and Professor De Cuzzi mainly. A lot of biomechanics done by the team at the Institute for Orthopedic Research by Phil Noble, Hugh Jones, and the imaging that we developed that's been developed by Raffaella Righetti at Texas A&M. So a very multidisciplinary team brought together with a common objective. First of all, generate a first generation of bio-nanoscaffolds that could do a lot of things. So they could provide for the loading and release of bioactive molecules. That could, with the curable polymers, provide the polymeric matrix that cures in vivo. With the bioactive peptides, something that can generate the right environment for the stem cells to grow, and something that can adhere to the bone end and not to the soft tissue. So this is the matrix that I put together while I was planning and envisioning the grant, and it's in 3 steps. So that's the first in vitro stuff, just the material part. Then all the biology that has to be developed to accommodate the stem cells and make them grow happy. A lot of animal models will be discussed in the presentation. And finally, the third stage in which we have developed everything with the clinical guidance of a team of wonderful orthopedic surgeons, and we have here in the audience one of them. Harvey, raise your hand. Harvey is one of the associates of Brad Weiner, who is our leader in the clinical guidance. So a very complex structure for kind of a simple idea originally, which is develop something that you can inject or mold, something really like a Play-Doh. That was the original idea that I had when I was thinking about this project. Something that you can inject in the part that is missing, so let's say like a gap in a long bone such as the femur or the tibia, that contains different components, and these different components provide all the factors and the environment that is necessary for the bone to heal. So the cells would reinfiltrate the area, will proliferate, minerals will be deposited, and eventually and hopefully the bone will form again. So we have already done like step 1, 2, and 3. We're now waiting for step 4. We still don't know if in the long run all the bone will be made. Despite that the idea was kind of revolutionary, because there is nothing like that, again, Mother Nature developed all of these in a pretty spectacular way. So bones in general can heal, and can heal in a very good way through a series of steps. And so what I did at the time was try to inspire myself from what happens in nature and try to replicate it in the lab. We did a lot of work in terms of biomaterial integration. So unfortunately, I cannot give any of the details because the patent attorneys grilled me for like an hour. So a lot of the details, unfortunately, I can't give them. But we did a lot in terms of integration of 3 materials that never got together before. So amphiphilic peptides, polypropylene fumarate, and nanoporous silicon were never put together. And so we had to develop a lot of chemistry and functionalization in order to make them go together, in order to make them be cell-friendly, because eventually cells have to grow on this stuff. We did a lot of mechanical testing in order to achieve the mechanical properties that are required in order for this material to be mechanically solid. So the idea that Mitch Sakin at DARPA had is that, okay, this is the first thing that he said when he came to talk to us. He said, I want a material that the soldier can inject behind the rock, and after 2 hours he can go back in the battlefield. And he said, yes, to get shot again. That's what I said, because that's crazy. So we managed and we negotiated a little bit back and forth, and eventually he agreed, okay, you guys got 2 weeks to have a complete mechanical stability. So you inject this material can stay in the leg of the soldier while the soldier is immobilized for 1-2 weeks max. But after 2 weeks, the soldier has to be able to walk on that thing. And after 6 months, that injectable material that you introduce should be disappeared, and at its place there should be natural bone. So that was that's the goal. That's what I think about day and night. So we developed a lot of mechanical tests, and we started from this was the first one, the first material that we developed. Very poor mechanical properties. We increased it a lot. We're now very happy. We can do different type of cross-linkings, just chemical, temperature mediated, the UV light, so something like the UV light that dentists used.